Good evening, everyone, and welcome to tonight's debate. We are here to discuss a profoundly important question that impacts societies worldwide. Is providing universal health care the best public health approach? This is a topic that evokes passionate responses and involves complex considerations, from ethical principles to economic realities. We have two distinguished guests with us tonight to explore this issue. Arguing for the motion is Mr. Samuel Green, a renowned public health expert and a staunch advocate for universal health care. And arguing against, or rather proposing alternative perspectives, is Ms. Olivia Clark, an economist specializing in healthcare policy. Our format will begin with opening statements from each speaker, followed by rebuttals. We will then move into a moderated discussion before concluding with closing statements. I trust that our discussion will be both enlightening and respectful, focusing on evidence and well-reasoned arguments. Let us begin.
Thank you, Dr. Vance. Good evening. I am here today to argue that universal health care is not merely a policy option. It is a moral imperative, and indeed, the most effective and equitable strategy for ensuring public health and societal well-being. Universal health care, at its core, is built on the principles of equity, accessibility, and affordability. It means that every citizen, regardless of their income, social status, or pre-existing conditions, has access to comprehensive healthcare services. The benefits are substantial and well documented. Countries with universal healthcare systems consistently demonstrate improved health outcomes across their populations. We see lower infant mortality rates, longer life expectancies, and better management of chronic diseases. Furthermore, by reducing health disparities, universal healthcare fosters a more just society. It prevents individuals and families from facing financial ruin due to medical emergencies, a situation all too common in systems without such protections. Consider the economic advantages. A healthier population is a more productive population. When people have access to preventative care and timely treatment, they miss fewer days of work, contribute more to the economy, and lead more fulfilling lives. Nations like Canada, the United Kingdom, and Germany, among others, have implemented various models of universal health care, and while no system is without its challenges, the overall impact on public health and social cohesion is undeniably positive. These systems prove that it's possible to decouple healthcare access from employment status or wealth. Ultimately, access to healthcare is a fundamental human right, not a commodity to be bought and sold, nor a privilege reserved for a select few. Investing in universal healthcare is an investment in our collective future, building a society where everyone has the opportunity to thrive.
Thank you, Dr. Vance and Mr. Green. Good evening. The aspiration for every individual to have access to quality healthcare is one I wholeheartedly share. It is a noble and vital goal for any society. However, while the intentions behind universal healthcare are commendable, we must rigorously examine its practical implementation, particularly its economic sustainability and overall efficiency as a public health approach. My primary concern revolves around the immense financial burden that comprehensive universal healthcare systems can place on a nation. These systems are typically funded through significant taxation or substantial government borrowing, which can impact economic growth and individual financial freedom. We must ask if allocating such a vast portion of public resources to a state-controlled healthcare monopoly is always the most efficient use of those funds, especially when considering other pressing public needs. Furthermore, universal systems are not without their drawbacks. Patients in some countries with universal healthcare report experiencing long wait times for specialist appointments and elective surgeries. This can lead to frustration and, in some cases, a deterioration of health conditions while waiting for care. The element of patient choice can also be restricted, with limitations on which doctors or treatments are available under the state-funded scheme. This lack of competition can sometimes stifle innovation or responsiveness to patient needs. I believe we need to explore alternative models that might be more effective and sustainable. This could involve market-based solutions that encourage competition and efficiency, or more precisely targeted support systems ensuring that vulnerable populations receive the care they need without overhauling the entire system into a monolithic state-controlled entity. A robust public health infrastructure focusing on prevention, coupled with safety nets for those most in need, might achieve comparable or even better health outcomes with greater economic prudence.
Mr. Green raises important points about economic burdens, but I believe this perspective often overlooks the substantial long-term economic benefits that universal healthcare generates. It's not just an expense, it's an investment. When a population is healthy, workforce participation increases, and productivity soars. The costs saved from reduced absenteeism and the long-term management of chronic diseases, which are often exacerbated by delayed care, can significantly offset initial outlays. Moreover, a strong emphasis on preventative care, which is a cornerstone of many universal healthcare systems, is far more cost-effective than treating acute illnesses and emergencies that arise from a lack of access to basic health services. Regarding concerns about wait times and limited choice, these are often overstated or are indicative of underfunding or inefficient management, rather than a fundamental flaw in the concept of universal healthcare itself. Many highly ranked universal systems manage these aspects effectively. These challenges can be addressed through intelligent system design, adequate resource allocation, and continuous improvement. And surely a potential wait time for a non-urgent procedure is preferable to no access to care at all, which is the grim reality for many in systems without universal coverage. Ultimately, we cannot sidestep the ethical imperative. Allowing financial status to dictate access to life-saving or health-preserving treatment is a societal failing. Universal healthcare upholds the principle of human dignity.
Mr. Green's optimism about long-term economic savings is understandable, but the certainty of these savings materializing to fully offset the high upfront and ongoing costs of universal healthcare is debatable. The immediate tax implications for individuals and businesses are very real and can be substantial. These higher tax burdens can potentially stifle economic dynamism and investment. Furthermore, predicting future healthcare costs and savings is notoriously difficult, subject to demographic shifts, technological advancements, and unforeseen public health crises. My concerns about government inefficiency and bureaucracy in managing vast, complex healthcare systems remain significant. Large public sector monopolies, even with the best intentions, can become unwieldy, slow to adapt, and less responsive to individual patient needs compared to more agile, competitive models. Innovation in medical technology and treatment methods often thrives in environments with competition and diverse funding sources, which can be dampened under a heavily centralized system. I contend that focusing on robust public health initiatives, such as widespread vaccination programs, comprehensive health education, and ensuring environmental safety like clean water and sanitation, combined with targeted financial assistance for those who genuinely cannot afford care, can achieve remarkable improvements in national health outcomes. This approach allows for resources to be directed efficiently towards prevention and support for the vulnerable, without the potentially crippling economic and bureaucratic overheads associated with a full-scale, one-size-fits-all universal healthcare system.
Thank you both for those compelling rebuttals. Let's delve a little deeper. Mr. Green, Ms. Clark raises valid points about potential inefficiencies and the risk of overburdening state finances. How can a universal healthcare system be designed to mitigate these risks effectively, while ensuring quality and accessibility for all citizens, not just a select few?
That's a crucial question, Dr. Vance. Mitigating inefficiency in a universal system involves several strategies. Firstly, strong emphasis on evidence-based medicine and health technology assessment ensures that funded treatments are both effective and cost-efficient. Secondly, transparent governance, robust auditing mechanisms, and clear performance indicators for healthcare providers are essential to maintain accountability and drive continuous improvement. We can also incorporate mixed models, where a foundational level of universal public coverage is complemented by regulated private options for those who desire them, fostering some competition. Furthermore, investing in digital health infrastructure can streamline administrative processes, improve data management, and enhance patient access through telemedicine, reducing overheads. It's about smart design, not just more spending.
Thank you, Mr. Green. Ms. Clark, while you highlight economic concerns and advocate for targeted support, how do you address the ethical dilemma of individuals being denied essential health care simply due to their inability to pay? And what are the broader societal costs, such as loss of productivity, social unrest, or worsening public health crises, that might arise from such a situation where access isn't guaranteed?
Dr. Vance, the ethical dilemma is indeed a serious consideration, and no compassionate society wants to see individuals suffer due to lack of access to essential care. My advocacy for targeted support aims precisely to prevent this for the most vulnerable. This involves creating robust safety nets, perhaps through means-tested subsidies, publicly funded clinics in underserved areas, or state-backed insurance for low-income individuals and those with pre-existing conditions. The goal is to ensure a floor below which no one falls. Regarding societal costs, these are undeniable if large segments of the population are left without care. That's why effective public health measures and targeted interventions are critical. The debate isn't about whether to provide care, but about the most sustainable and efficient mechanism to do so for the entire population. A system that bankrupts the state or stifles the economy could, in the long run, reduce the resources available for everyone, including for healthcare.
Throughout this discussion, I have emphasized that universal healthcare is fundamentally about fairness, human dignity, and building a healthier, more productive society for everyone. It is an investment, not merely an expenditure. The evidence from numerous countries demonstrates that universal systems lead to improved public health outcomes, longer lives, healthier children, and better management of diseases. They reduce the crippling fear of financial ruin due to illness. The economic advantages are also clear. A healthy workforce is an efficient workforce. Preventative care reduces the need for costly emergency interventions down the line. These are tangible benefits that strengthen our communities and our economy. Concerns about cost and efficiency, while important, can be managed through intelligent design, technological adoption, and a commitment to continuous improvement, as seen in many successful systems globally. The alternative, a fragmented system where care is rationed by ability to pay, is both ethically problematic and ultimately detrimental to society's overall well-being. Choosing universal health care is choosing to invest in our people, in our collective future. It is a declaration that every life has value and that everyone deserves the chance to live in good health. Let us strive for a future where access to healthcare is not a privilege, but a guaranteed right for all. Thank you.
I too believe in the goal of a healthy populace, Mr. Green, and I appreciate the depth of this discussion. However, I must reiterate my significant concerns regarding the broad implementation of universal healthcare as a one-size-fits-all solution. The primary challenges remain its financial unsustainability in the long term for many economies, the potential for systemic inefficiencies, and the impact on individual choice and market dynamics that drive innovation in healthcare. While the vision of universal coverage is appealing, we must be pragmatic about the resources available and the potential for unintended consequences, such as prolonged wait times or limitations on access to the latest treatments if not managed with extreme care and massive, ongoing investment. I maintain that alternative approaches, which focus on strengthening public health infrastructures, promoting preventative care, and providing targeted support for vulnerable populations through well-designed safety nets, can achieve excellent health outcomes more sustainably. These models can preserve economic vitality and foster innovation, ensuring that resources are used efficiently to help those most in need without imposing an overwhelming burden on the entire society. The goal of ensuring better health for all is shared. However, the path we choose must be carefully considered, balancing noble aspirations with economic realities and the complexities of human systems. Thank you.
Thank you, Mr. Green and Ms. Clark, for a truly insightful and thought-provoking debate this evening. You have both presented your arguments with clarity and conviction. Mr. Green has passionately argued for universal health care as a moral imperative and an effective public health tool, emphasizing equity and long-term societal benefits. Ms. Clark, in contrast, has raised important questions about economic sustainability, potential inefficiencies, and has advocated for considering alternative or more targeted approaches to ensure public well-being. It is clear that there are no simple answers to this complex issue, and the best approach likely involves careful consideration of diverse factors, tailored to specific national contexts. We hope this discussion has provided our audience with a deeper understanding of the different perspectives and encourages further reflection on how we can best achieve health for all.